Well, hello everyone, and welcome to Dementia Unplugged. I'm Jeannine Forrest, and I'm very excited that you are spending this time and your energy to learn and listen and discuss Sundowning Reconsidered. The way this format usually works is that I'll be presenting some information for about 30 minutes, and then we'll open it up to question and answer by the chat button located on your Zoom screen. Before we get started, it's important to listen to a few words from our president of the Dementia Society of America, Kevin Jameson.
Welcome. Please listen to this important message from the Dementia Society of America. All content, including any potential medical information, is provided as an informational resource only and is not to be used or relied on for any diagnostic or treatment process. It should not be used as a substitute for professional diagnosis, care, and treatment. Please consult your healthcare provider before making any healthcare decisions or for guidance about a specific medical condition. The opinions expressed and the content shared by Dr. Forrest are not necessarily the opinions and content of the Dementia Society of America. Thank you.
The way we like to start this program is to make sure we're all talking about dementia in the same way. Dementia is really an umbrella term. It's not a disease in and of itself, but it really does sort of represent a whole variety, perhaps up to 400 different diseases or conditions that change cognitive functioning over time. And so the more common types of dementias, diseases that you may be more familiar with are Alzheimer's related disease, vascular dementia, mixed dementia, Lewy body dementia, frontal temporal, a whole variety of conditions that change, again, cognitive functioning progressively over time. So it's also important to note that dementia is not a normal part of aging. That said, we're going to be talking about this condition, this phenomena called sundowning today that may impact any one of these different conditions under the umbrella known as dementia. Sundowning. Some of you may be coming to this podcast because you are family caregivers, experiencing changes as the day goes on with your loved one. Maybe late in the afternoon, you're seeing more of an aggressiveness or a restlessness. Some of you may be coming to this podcast because you're in a care facility and seeing these changes late afternoon after late afternoon, maybe one, two, or more of the residents you're caring for. But what really is this sundowning? What's it all about? Now, interestingly, it was really captured in the literature only about 1941, and it was called Senile Nocturnal Delirium by a Scottish psychiatrist, Ewan Cameron. The way he describes this is sort of a collection of what we would call neuropsychiatric symptoms taking place during the late afternoon, can happen in the evening, towards night. The idea here is that it's cyclical in nature. And just like you, what he observed were changes in behavior that would include things like verbal outbursts, sense of restlessness and unease, an increase in confusion, agitation, and perhaps there may be hallucinations as well. So senile nocturnal delirium is quite a mouthful, and the word sundowning became more popular. As we move forward, I hope that we could reconsider this to be more than just when the sun goes down. There may be other explanations that could pause our care and give us hope. It's important to know that sundowning is not a diagnosis in and of itself. At this point, you may be surprised to learn that there's no real clear definition or a lot of conclusive research that's been targeted to this experience called sundowning. And it's really not well understood, but people talk about it clinically, anecdotally. So what do we know? The work that has been done offers a few explanations. Some include what we might consider a shift in one's biological clock for waking and sleeping. This would be considered a shift in circadian rhythm. Others include fatigue, overstimulation, depression, pain, boredom may be the underlying triggers. For others, there's been more sort of research into changes in melatonin and stress hormone. It's also important to note that as we understand it at this point in time, sundowning is different than how we usually think of the concept or the condition called delirium. Delirium also includes changes in behavior and cognitive functioning, but it can also occur outside the realm of dementia. People without a history of any form of dementia can develop a delirium, and it's usually an older adult, although some children do experience it after surgery, or if an older adult becomes severely dehydrated, or if an infection takes place. And these are usually reversible. The nature of delirium is that there's a sudden acute onset of it. It's fluctuating in nature. It sometimes can be considered more of a medical emergency where one needs to really address the underlying infection or poorly controlled pain, or it could be one is what we call hypoxic. There's a lack of oxygen, or there may be too many medications happening at the same time, and there's a mix of the side effects. That's called polypharmacy. Needless to say, there's a lot of study that needs to be done, and I was excited to learn about a group of global stakeholders across the globe that have been pulling together to look at this other problem called delirium. And I leave you the hyperlink to an article that's called The International Drive to Illuminate Delirium, a developing public health blueprint for action. And this was just released in March of 2020. So delirium is a whole other topic that we can address, but there are many similarities, but the difference is that sundowning is much more cyclical in nature. So I've said it a couple times that I want to reconsider this concept called sundowning. And it's been my clinical experience in my own practice, as well as working with a few other colleagues who are expert in this area, to think about sundowning a little differently. I want you to reimagine it and think about it as brain overload. For those of you who are just listening in, I move from a picture of a sunset to a brain that's just exhausted. It's a cartoon figure of a brain that's just sort of wiped out on a workout bench. So let's delve more into what do I mean by brain overload. The first time I really heard about this was in 2012 by a colleague, Tina Alonso, who's the director of research at the Beatitudes campus in Phoenix, Arizona. And she writes this article, Hard Day or Hard End of the Day, Shedding New Light on Sundowning. And her whole theory here is that the brain is over fatigued by the end of the day. It just so happens to coincide when the sun goes down. What we mean by this, just imagine if you were the one experiencing some form of dementia and how much energy and work it takes to stay focused, to concentrate, to make sense of the world. Imagine waking up and not knowing what to do next, not really understanding a routine of the day, not knowing who is in your environment, not knowing if you're safe or not understanding why you may be uncomfortable. Just imagine the overload it would take to get through things we take automatically. Say, for example, waking up and brushing your teeth. We do it just sort of on autopilot. But for people with dementia, each one of those steps takes concentration and energy. And just imagine by the time you finish eating breakfast, how exhausted you may be, your brain may be. So Tina came up with this wonderful idea, and working with her care staff at the Beatitudes, thought of whenever our residents look tired or fatigued, have them rest. So it became the rest when tired philosophy. Don't wait to the end of the day before you let people just either just stretch out, take a little cat nap, to stay away from the overscheduling. Her idea, again, was rest when tired philosophy, and there really was a lot of positive outcome from that. So what did that look like? And this is also what I encourage, people who I work with, but certainly, as Kevin said, any one of these conditions, you need to have your own medical providers help you distinguish. But I want you to perhaps have the dialogue with your practitioners about these strategies to consider. Number one, this is the one that I find the most important, is avoiding overscheduling so that one becomes over fatigued. I show a picture of a sort of activity schedules that are very common. And I find that people have a tendency to go from one activity to the next, to the next, to the next. And that leaves no downtime for the brain to recover, or one's energy to recover. Imagine if you had the same schedule, even with different activities, where you were sort of programmed throughout the day, 5 days a week, 7 days a week. That's a little stressful, at least it would be for me. So avoid overscheduling. The other important clues are to expose the person who is experiencing dementia to some form of daylight. Now, you're not putting them out in the blistering sun, but perhaps sitting near a window, having the distinction between day and night with real sunlight as opposed to artificial or fluorescent light is important. Other pieces include staying well hydrated to prevent the dehydration. There's a big focus on keeping one well pain managed. First of all, identifying when pain takes place. Movement, daily exercise also plays a role, because people have a tendency perhaps to hallucinate and maybe mix up light and shadows. Ensuring that their eyeglasses are on, hearing aids are working, so that there's no other distortion or a less distortion in terms of sensory inputting into the brain. additional pieces to consider are maintaining a structure and routine through the day. Not in terms of monotony, but if you know what to expect, if you know how to, what your day may be more like, there's less of a strain in being constantly surprised and perplexed. So that's the importance of maintaining structure and routine. You're less stressed about trying to figure out the next steps. The other piece is avoiding clutter. I don't know about you, but I need to kind of clear off my desk, get my house in order, especially if I have a big project due. It helps me think better if I have less clutter. Well, clutter also creates clutter in a sense in the brain. There's an additional stressor, especially for people with dementia. So if there is less of it, it helps people to think and focus more. Avoid loud noise, especially the TV. If the TV is on in the background, that can be an incredible distraction and one is less able to focus. Now, if that goes on all day long and you have a crescendo of lots of activity, lots of noise throughout the day, by the end of it, you can imagine why people may be at their wits' end. For those of you in care communities, what Tina Alonso did, and what I encourage, is look at your change of shift. Is there a lot of noise and commotion and saying goodbye and all of that extra noise and activity can be stressful. And so they made it such that there is a very peaceful sort of non-event event during change of shift where there isn't a lot of coming and going, but people just quietly sort of start their days and end without a lot of goodbyes. And so this also promoted a lessening of some of the sundowning behaviors towards evening. What I like to encourage, and this is what Tina did as well, is you build in rest periods. So you can consider them as an activity. Resting is an activity. Resting and restoration are activities, but they need to be built in because it is important to have these rest periods as just part of the day. And it's helpful to have them built in after breakfast and before dinner. And what does that mean? It doesn't mean sleep, although some people might fall asleep. But what I mean by rest periods is that people change position. They're not in the same chair. They are definitely stretching out, getting pressure off of their backs and lower extremities. It's a time to close your eyes. And I give you some examples of what that might look like. But the important message here is they're built in through the day. For about 40, 45 minutes, 60 minutes. For some, there may be just a period of quiet music in the background. Very, very quiet and mellow. For others, it would include maybe a few minutes of breathing exercises at the same time of changing position and just getting the extra pressure off of their joints and bones and lower back. One breathing exercise I would like you to think about, or maybe we could do right now, is you're going to take a deep breath in. And as you take a deep breath in through your nose, you raise your hands over your head. So it goes, Hands over your head, and exhale, you bring your arms slowly down. And breathe in. And as you move your hands down, you breathe out. Maybe do that 4 times. But you're providing the visual cueing if you are facilitating this event. And it helps to pace your breath. I encourage people to perhaps put timers on their phones to maybe do this a few times during the day. Add that to your rest periods. Maybe start them with breathing. We become overcommitted and overactive and overstimulated. And oftentimes we don't breathe as well. And we know through research and our own experience that if we take times out to breathe, that really helps us to relax. At the same time, it's also helping our overall system and our brains to relax. There could be moments of silence. Add that into your rest period. For others, I've had people who are faith-based have prayer circles. Maybe it doesn't last for 60 minutes, but maybe 15 minutes of that 60-minute rest period include just a few quiet prayers. I had an amazing experience when I did work in China. And in a care facility, I walked in and it was absolutely silent, which was unusual for those of you who know this world. But it was between the hours of 2 and 3 p.m. Not only were the residents resting, but the staff was resting as well. And everyone was just sort of stretched out, quiet in the same circles. And it was so peaceful. Now, I bet some of the administrators who are listening here are thinking, what are you suggesting here? All I know is it really added to the sense of tranquility and peacefulness and less exhaustion and less sort of frazzled experience that one can experience when you are in care facilities. And this so happened sort of prior to what we would anticipate as these sundowning time frames. And when all of this took place, there was much less of that late afternoon confusion. So I am wanting you, as you're sort of jotting down notes here and thinking of different ideas, I would like for you to think about how you may be able to implement sort of these structured rest periods throughout the day. Imagine having a brain perhaps on, with sunglasses, sitting by the pool, relaxing. If that's the image, that's what the one I want to have sort of sustained in your brain. What is it that would be helpful for maybe your loved one at home to sit and listen to their favorite quiet music, turn off the TV, maybe just, quiet the environment so there's not a lot of bright artificial light, but soft sunlight, real sunlight. Putting on perhaps a blanket. For some, if they're anxious, maybe a weighted blanket. What I hope you're hearing here is it isn't going to be just one magic sort of pill. In fact, I don't talk about adding medications at all. We want to work with non-drug interventions whenever possible. So, the outcomes that Tina Alonso experienced, although she did not quantify it, but in her article, The Hard End of the Day, Shedding New Light on Sundowning, and it's been my experience as well, that there has been we would call sort of a significant reduction in sundowning symptoms, less use of sedatives, antipsychotics, less caregiver fatigue at the end of the day. There is a guide that I'm very proud of having co-authored with my colleague Dan Kuhn, and it's all about comfort care. Encouraging comfort care, a guide for families of people with dementia living in care facilities. We were working with the Alzheimer's Association at the time. And this is a downloadable guide that you can search for. It's free. It's about 24 pages. And the reason I bring this to your attention, because many of the suggestions or strategies that I talk about are honed in this comfort care guide. It's all about comfort. And if someone is experiencing pain consistently through the day, I want to walk you through a scenario. Someone sits in a wheelchair in the morning after breakfast. They may get up to be toileted once or twice, but in general, they're sitting in the same position throughout the day. Let's lay a layer of arthritis on top of that. And now, again, you're sitting in the same position. I don't know about you. I can barely sit in the same chair for an hour. Now imagine you're sitting in the same chair for perhaps 8-10 hours at a time. By the end of that day, when the sun is going down, imagine how much discomfort you may be having. And it's this causative factor that propels the agitation in many scenarios. And so we have a tendency to place everything in a black box, or in this case, in what I would call the sun setting. We can often explain things away that doesn't allow us to investigate them. So if I attribute everything to, oh, that's just the sundowning, oh, that's just the dementia, what does that do? What that does is it causes us and people with dementia to live this experience day to day, day in and day out, when in fact, if we do our due diligence of investigating the underlying triggers, which include pain management, which include a whole variety of ways to provide comfort, what we found that this helps to dissipate and perhaps prevent some of these sundowning behaviors. I, in fact, like to even wipe out the word sundowning. I like to just say, how are we over fatiguing someone? In what way are their comfort care needs not being met? So that's a way of reconsidering, reimagining this whole idea of sundowning. Another addition or resource to think about is the National Institute on Aging, Alzheimer's and Related Dementias Education Center. I give you the website. There's also information on a whole variety of pieces that are near and dear to people caring for people with various dementias. So, what I hope is that I offered you a new way of reconsidering this phenomena called sundowning. What we're trying to do here is really learning to care before finding the cure or cures. It's still a long way off before we're going to be able to find the answers to many of these questions. But we are learning how to care together. I do want to thank the Dementia Society of America for hosting this Dementia Unplugged webcast. Please take a moment to review their website. It's chock full of information. Encourage you to also perhaps give a donation. It's an all volunteer organization. If you need additional information with respect to your situation, you can sort of hire me through my own private practice. It's called Through the Forest, but I offer a service called Dementia Coach on Call, or you can just call me at 773-704-1834. So I'd love to be able to walk you through and perhaps give ideas and suggestions to think about with your own situation. So what I do next is I stop the recording on this next slide as we offer the opportunity for you to invite and send your questions. That way it just adds another layer of privacy.